When providing personal care for a client, the home support worker may have to assist with bathing, perinatal care, oral hygiene, grooming and dressing, and massage care when required. Also, your client may wear hearing aids and may need assistance with positioning them in their ears. They are delicate and very expensive, so handle them with care. Speak to your coordinator if you have any concerns. Now let's talk about baiting our clients. It can help keep a client well, and it can be an opportunity for you, the home support worker, to make important observations about the client. A client may bait in different ways depending on the client's health condition and how comfortable they are with the process at that time. Ways that a client may bait are complete bed bath, a partial bed bath, a tub bath, or a shower. Some things to remember when baiting a client in a home setting. Always follow the client and family preferences for time and type of baiting that works for them. Always consider the total care policies pertaining to providing care. In some cultures, they may only approve to have a family member to assist with their baiting. Always ask if the client would like a back massage to help promote circulation and relaxation after any bath procedure. Depending on the frailness of a client's skin and their health condition, they may not be able to feel the temperature of the water. Therefore, you will need to ensure that the temperature is safe for the client. If you are alone with the client, you should also use a thermometer to ensure a safe temperature. Now let's look at things that the home support worker should observe for on the client's skin during either baiting process. Any new bruises that may be present, color of the skin, any rashes that may be on the skin, any broken skin or reddened areas, especially around bony areas, any swelling of their feet or legs, the skin temperature, any pain or discomfort during the baiting process. The worker will want to document any findings and do any incident reports that may be required for any new broken skin. Before performing a bed bath, it is important to review the care plan to familiarize yourself with the client's ability to assist you and any special considerations that you may need to be aware of. You want to ensure privacy and dignity when doing a bath and keep your client covered as much as possible. Ensure that we keep with how they like to have the process done and the preferences that they may have. Always have the bed at the appropriate height to ensure proper body mechanics, and change the water as often as needed or when it becomes soapy. Some suggested steps for a complete bed bath are: confirm the client is okay with the bath. You want to always explain your steps to the client while performing them. Offer a bedpan or urinal prior to the bath. Perform 5 moments of hand hygiene. Collect all supplies needed. Ensure privacy as much as possible. You want to raise the bed to a comfortable working height and then lower the rail. Perform oral hygiene if required. This is very important as oral hygiene is a very important part of being healthy. Cover the client with a sheet. Put the bed rail up and get a basin of water. Ensure temperature of the water is appropriate. Lower the bed rail. Then cover the client's chest with a towel. Make a mitt with your face cloth. Wash around the client's eyes with water only. Gently wipe from the inner part of the eye to the outer with the corner of the mitt. Ask the client if they use soap on their face and following their suggestion, wash the face, ears, and neck. Rinse if soap is used and pat dry. Then expose their arms one at a time to be washed, but keep the client from being exposed as much as you possibly can. Always rinse and pat dry each area when done. If the client's hands and nails are visibly soiled, soak them and then clean them underneath with an orange stick. Now clean the legs one at a time and then place a towel underneath the feet before cleaning them. If the feet are visibly dirty, you may need to soak them. Clean between the toes and ensure they are dry, and do not put any cream between toes to prevent bacteria growth. Ensure the rail is up and turn the client toward the rail to wash the neck and back first and then the buttocks. Dry and then provide a back rub to aid with circulation. Next, you will need to change the water before performing perineal care. Ask the client if they would prefer to do their own before proceeding, and only if it is safe and able to be completed by themselves. Apply deodorant and lotion as per the care plan and put on any selected clothing. Provide hair grooming as required. Change any bed garments by making an occupied bed if trained to do so. If not, you will be given practical training to ensure safety of a client and yourself. Ensure the bed is in its lowest position and the rails are up. You want to ensure items needed by the client are within their reach. Perform the 5 moments of hand hygiene, and then when finished, you want to document the care given. When performing a partial bed bath or assisting with a partial bed bath, ensure the bed is in the lowest position. Gather all supplies as you would for a complete bed bath. Ensure that the water temperature is okay for the client, and ask the client what they will need you to do for them. But remember, it is always important to let a client do what they can safely for themselves. Allow privacy if it is safe to do so. After the client is done, you should ask, is there anything else they would need you to do for them? Assist with changing the linen when required. When done, offer a back massage, again to assist with circulation. Ensure the client is in a comfortable position and the bed is in its lowest position. Ensure the client has everything they need within their reach and then document the care. Bathing the client in a tub and shower. Some clients are still capable of doing tub baths and showers on their own, but may need you to assist with the process. Gather all supplies that will be required for the bath or shower in advance. Adjust and ensure the temperature of the water in advance due to clients having health issues that may not allow them to feel the correct temperature. Ensure that all safety equipment is available to keep them safe. Examples of this would be grab bars, bath chairs, mat for the tub, and a lift if it is required. Ensure the client is always safe, assist where needed, and if safe to do so, provide privacy and always consider their culture and preferences. Some baiting considerations that you need to think about. When baiting a client, you may have to deal with challenges that can arise. The client may urinate or have a bowel movement during the procedure. If this happens, reassure the client that it is okay and assist where needed with perinatal care, changing of linens, tub water, and when finished, and if okay with the client, proceed with the baiting procedure. If a client refuses a bath, it is their right. Listen to the client to see how you can help and always provide reassurance. A client living with dementia may be willing to have a bath, and when it is prepared, they may decide they are not getting in. If this happens, do not force them. Reassure, and if required, try again later. A client may not be able to tolerate the baiting position. You may have to adjust the procedure to meet their needs. A male client may have an erection during the baiting process. When this happens, offer privacy or continue with the bath if you are comfortable. Always ensure safety of the client. Now we will talk about perinatal care. It is very important to provide or assist with providing perinatal care, meaning cleaning of the genitals and the anal area, at least once daily to help prevent infection, odor, and skin breakdown. Allow the client to do as much as possible for themselves when possible and safe to do so. The steps that you should follow are to put on the appropriate PPE, wipe from the cleanest area to the back anal area, from the top to the bottom to carry away any germs, for example, water drips. You want to clean starting farthest away from you. When a client soils themselves, wash their buttocks first and then the anal area. When washing a male, push back the foreskin if they are not circumcised to clean that area. When washing a female client, always ensure you clean between the labia with downward strokes to help prevent infection. Grooming is a very important part of personal care because it not only helps promote a client's well being and self confidence, but it also helps prevent infection. Personal care includes nail care. A few things to remember with nail care is if your client is a diabetic, you are not permitted to cut their toenails. This would need to be done by a professional. If your client's fingernails or toenails are visibly dirty, you may need to soak them first and then clean beneath them with an orange stick. When applying moisturizers and lotions, you want to make sure that you do not put it between their toes because this can cause fungal growth. Hair care. Please stick with your client's preferences for the products they like to use. As well, you want to consider the technique that is safest and most comfortable for your client. Shaving. Your client may use a disposable razor or a straight edge razor, or they may also use an electric razor. Please ask your client which works best for them. Dressing. Not all clients are capable of dressing and undressing themselves, and you may require to assist them, or you may have to do it completely for them. Stick with clothes that is most comfortable for your client. When dressing or assisting your client to dress, there are some considerations you may want to be aware of. Try to provide as much privacy as possible if it is safe to do so. You want to encourage the client to do as much as they can for themselves and help them keep their independence. Let them have choices in what they want to wear. And you want to pay particular attention to the client when you are dressing them to ensure they are comfortable with the procedure and not in pain. If possible, encourage the client to choose clothes that is easy to put on and take off and more comfortable for them to wear. If the client wears compression stockings for support, it is very important to ensure they are on properly and do not have creases in them. Please see the care plan or discuss with your coordinator for guidance. A client may be incontinent and require wearing an attend or pull-up. It would be appropriate to wear an attend if they are incontinent of urine or feces, and a pull-up if they have occasional leakage. Your client may be unable to move one side of the body due to a stroke or other ill condition. When this is the case, always put the client's clothes on the affected side first, and when you are removing their clothing, remove from the unaffected side first. Always remember to check their skin color and skin temperature. Look for swelling of the legs or feet and any skin breakdown. Please document any findings and do an incident report if required. Now let's talk about incontinence. It can be very embarrassing for a client and even affect a client's self-esteem and cause them to avoid any interactions or activities with others. Some clients may have a form of dementia or stroke and may not be aware or understand what is happening to them. You, the home support worker, can help reassure the client and even minimize the incontinence. Some considerations are: give the client the opportunity to go to the bathroom or use a commode regularly. This can lessen the amount of incontinence. Ensure we encourage the appropriate garment for the situation. A client can wear an attend or a pull-up. Encourage the client to change the attend often to help prevent skin breakdown. Provide skin care and change all garments and bedclothes as often as possible. The client may have a catheter, however, you will need to be delegated by the agency RN to provide this care.